For the treatment of HIV/AIDS, we're facing two issues. One is how to keep patients on treatment long term, and the other question, how to further expand treatment access to patients. And to keep patients on treatment, that is increasingly becoming an issue for Médecins Sans Frontières, because after 5 years of treatment in one project, we see that 20% of patients are resistant even if they have taken the drugs, and we estimate about 3% of our patients will become resistant every year. And the drug price is then becoming a major issue for these new medicines. It's much higher. It's a bit of a déjà vu that we have, and seeing again high drug prices. But the situation today is much different in the sense that we have patent protection today for these newer medicines in the producing countries. So it's India, it's Brazil, Thailand, those countries that actually can produce those medicines that have patents, and the differential prices that are offered by companies are not sufficient. That is a big issue, but also having simple tests to actually detect the treatment failure in patient is increasingly an issue. Simplified viral load test is an urgent need, and we see that diagnostic companies have not been interested really to develop it. So we are behind, and it's becoming extremely urgent to have such tests. When it comes to expanding treatment access, what we're increasingly facing is the lack of human resources. If you just look at Lesotho, for example, it's a country where about 40% of the patients that need antiretroviral treatment today are getting it. And there's a great lack of trained healthcare workers, and this is becoming a major bottleneck to expanding access. Because healthcare workers are often dying themselves of HIV/AIDS, and because many healthcare workers are leaving the country because of poor salary, harsh working conditions. And so when we surveyed health workers in Lesotho, 70% of them said they want to leave the country. So this is an emergency situation where something has to be done to keep healthcare workers in the country, to give them the better working conditions and salaries, and also to try increasingly to shift some of the workload to other, for example, lay healthcare workers that can be trained, so some degree of task shifting is critical to meet the needs.